There are several psychotherapy modalities that aim to treat the symptoms of trauma. Some of these include eye movement desensitization and reprocessing, EMDR, cognitive processing therapy, CPT, prolonged exposure, PE, somatic experiencing, polyvagal therapy, internal family systems, compassionate inquiry, dialectical behavioral therapy, or DBT, acceptance and commitment therapy, or ACT, accelerated resolution therapy, ART, and psychoanalysis. These are only to name a few. According to the PTSD clinical practice guidelines by the VA, there is strong evidence for what are referred to as the big three modalities: cognitive processing therapy, eye movement desensitization and reprocessing, and prolonged exposure, each with their benefits and caveats. Overall, just like the picture we see in pharmaceuticals, psychotherapy is somewhat effective for trauma. 30% don't respond, and 30% drop out. According to studies, most individuals drop out of trauma therapy because of distress associated with the reactivation of trauma, which some approaches manage effectively where others may not. Instead of providing a full review of each individual trauma therapy modality, I thought it would be helpful to extract and explore the underlying mechanisms of trauma therapy that are similar across the most evidence-based trauma therapy modalities available. Among trauma therapy modalities, there are 4 ingredients: relationship, regulation, reprocessing, and restructuring. Relationship refers to the therapeutic relationship, which is central to trauma therapy because it provides a safe, trusting, and consistent environment in which healing can occur. Trauma often involves interpersonal violations that damage a person's sense of safety and trust in others. A strong therapeutic alliance helps to repair this damage by modeling a secure, attuned, and respectful relationship. Through this relational safety, individuals can begin to regulate emotions, reprocess traumatic memories, and develop healthier patterns of relating through restructuring. The therapist's compassion, presence, and reliability are often more healing than any single technique. This is in fact supported very strongly by the literature. Therefore, in trauma therapy, attuning to the strength of the relationship is critical. Regulation refers to the ability to regulate emotions. Trauma dysregulates the nervous system, leading to overwhelming emotional experiences. Developing emotion regulation skills allows an individual to stay grounded and present, which is essential for safely processing traumatic memories. These skills also empower individuals to manage distress outside of therapy, reducing the risk of triggering to the point of overwhelm and supporting long-term recovery. Regulating emotions creates the stability needed for deeper therapeutic work. Reprocessing refers to the processing of traumatic memories. Unprocessed trauma can remain stuck in the nervous system and body, leading to symptoms like flashbacks, hypervigilance, emotional distress, as well as physical manifestations stemming from the disturbances in the adrenal glands, gut, immune system, metabolics, and micronutrient environment. By safely revisiting and making meaning of these memories within a supportive therapeutic environment, individuals can reduce the emotional charge, integrate the experience into their life narrative, and shift from a survival-based response to a more adaptive one. This process helps restore a sense of agency, coherence, and emotional freedom. Restructuring is important in trauma therapy because traumatic experiences often restructure beliefs about the self, others, and the world. For instance, I'm unsafe, it was my fault, or I can't trust anyone. These beliefs can reinforce fear, shame, and helplessness. Restructuring helps individuals identify, challenge, and replace maladaptive beliefs with more balanced, realistic ones. This is often easier said than done because many of these beliefs lie underneath the surface, tied to implicit memories. emerging throughout the process of trauma therapy. This shift in thinking supports emotional healing, enhances self-worth, and promotes more adaptive coping and behavior. Beyond beliefs, trauma structures the body, lifestyle, and other unfolding life processes around survival. While initially helpful, these patterns can hinder the ability of the individual to move from striving to arriving, from surviving to thriving. So, by extension, restructuring also includes consideration for the larger impact of trauma and how to support internal healing processes. Some of this work steps out of what's normally done in the context of psychotherapy and incorporates the use of laboratory and diagnostic testing to help identify areas that need support. Each of these 4 ingredients is essential to effective trauma therapy and are consistent across all major trauma therapy modalities. Trauma work cannot begin without establishing safety through a supportive relationship. Strategies to reestablish regulation bridge the nervous system back to a place of safety for processing. The trauma stored in the body is metabolized or thawed out by reprocessing. And along the way, the underlying meaning of trauma and the impact it has had on the body and lifestyle is restructured into a more workable narrative that moves an individual from surviving to thriving. The overarching method of trauma therapy can be condensed into 2 steps: desensitization and integration. To desensitize, we build upon neuroception and interoception. Neuroception, a term coined by Stephen Porges, is the automatic and unconscious process by which the nervous system detects safety, danger, or life threat in the environment or in relationships, without the involvement of conscious thought. It influences physiological states through the autonomic nervous system. For example, triggering fight, flight, freeze, or social engagement responses. The focus of neuroception is external and relational cues, like facial expressions, voice tone, and body language. This primarily involves the autonomic nervous system. As an example, a person may feel tense or anxious around someone without knowing why. Their nervous system has picked up subtle cues of threat through neuroception. Interoception, on the other hand, is the perception of internal bodily sensations such as heartbeat, hunger, breath, temperature, or gut feelings. The function is to help regulate emotions, self-awareness, and homeostasis by giving the brain real-time information about the body's internal state. The focus of interoception is internal signals from the body's organs and systems. The systems involved include the sensory pathways to the insular cortex and related brain areas. Where neuroception is strongly informed by polyvagal theory, interoception is strongly informed by somatic experiencing. A few examples of interoception are feeling your heart race before public speaking, or sensing butterflies in your stomach when nervous. So essentially, neuroception is externally oriented, and interoception is internally oriented. When you pair interoception with acute relaxation, you will not experience a stress response. When you pair interoception and neuroception with acute relaxation and exposure, you achieve trauma resolution. The basis of all effective trauma interventions stems from a principle called reciprocal inhibition. This is where a conditioned stimulus, for instance a trigger, plus relaxation leads to a desensitized conditioned response. Joseph Wolpe discovered this equation, and it has become the basis for several behaviorally and trauma-oriented strategies. With this in mind, I'm reminded of the quote from Viktor Frankl, "Between stimulus and response there is a space. In that space you'll find growth and freedom." I think what these interventions do is help widen the space such that the trigger does not overwhelm the system so much that the freedom of choice is removed. I also believe that in that space is where you find yourself again, so that you can move in the direction of not just trauma resolution, but post-traumatic growth and thriving. Now, I mentioned that there are 2 steps. The first, desensitization, we've covered. The second is integration. To integrate, we work with the narrative. In trauma therapy, integration refers to the process of bringing fragmented aspects of experience, memories, emotions, sensations, and beliefs, into a coherent and connected whole. Trauma causes disconnection within the self, between thoughts and feelings, body and mind, or past and present. Integration is important because it helps individuals make sense of their experiences, reclaim parts of themselves that were split off or repressed, and restore a felt sense of continuity and identity. This leads to greater self-awareness, emotional regulation, and the capacity to engage with life more fully and flexibly. This process involves a dance among the explicit and implicit aspects of memory to piece together a cohesive narrative systematically. So, with 4 essential ingredients, relationship, regulation, reprocessing, and restructuring, applied in a method involving 2 key steps, desensitization and integration, trauma therapists work to bring balance from a psychotherapeutic perspective. These ingredients are common among all therapy modalities, with variations among the techniques. Oftentimes, a trauma therapist will combine skills from several modalities to augment their approach. For instance, a combination of EMDR and somatic experiencing, or CI and IFS, among other things. A skilled trauma therapist knows what's most important is the relational safety they bring, and what invariably comes with that is a tremendous amount of self-work to process their own trauma and associated triggers. In my efforts to capture these elements of trauma therapy, I've developed a therapy procedure called Experiential Transformation that I use in practice and train clinicians in. This procedure works to restructure distressing experiences so they no longer trigger intense physical and psychological reactions, opening up access to one's potential. It is rapid, well-tolerated, transdiagnostic, non-pathologizing, and trauma-informed. This procedure works through guided invitations and inquiry, supported by bilateral stimulation technology like that used in EMDR therapy. The procedure combines well-validated techniques used in other traditional therapy modalities, guided by a unifying model. It can be used for PTSD, distressing experiences, grief and loss, anxiety and phobias, depression, addiction, and spiritual and existential distress. I'm in the process of developing a self-guided version of this procedure that can be used by anyone interested in processing stressful events on their own. More information about this can be found on my website linked in the description below. If this perspective resonates with you and you want to see more content, please like and subscribe. Leave a comment if you'd like for me to cover a specific aspect of trauma therapy that I haven't touched on yet, and stay tuned as we continue to dive even deeper into the nuances of trauma. To learn more, check out the additional videos and links in the description below.